Okay, but you said we need to work with what we have. That is, as you just said, you have a short amount of time before the end of the year. Do you think you need to extend the health care tax subsidies that are currently in place until you figure out all the rest of this complicated policy making?
Let me back you up just a little bit, Margaret. To say everybody assumes it's easy just to extend the premium tax credits, the enhanced premium tax credits. It's not that easy. 50% of the states did not plan on them being extended, and they don't have rates as if they were to be extended. So that means if we pass this mid-December, they've got to recalculate rates in time for, wait a second, by that time we're already into 2026. It's not an easy matter. And by the way, did I mention, the policies that people want to lower the premiums for have $6,000 deductibles. It is basically something for insurance companies to make money off of and for the individual to wade through $6,000 of debt before they can finally access it. Now, the kind of proposal I am proposing, Republicans are, and I hope Democrats will join, is let's take that money, and we have a mechanism to do so. Yeah. We give it to the patient. By giving her that money, she could choose a bronze level plan, which is to say lower premiums. So now her premiums are down, but she has money in an account to help with the deductible. And I think we can figure that out about as easily as we could figure out what we would do if we just did a straight out extension.
So you want to do all this, though, by the second week of December, when the Democrats have been promised they'll have a vote on an ACA bill of their choice?
Yes, and I tell my Democratic colleagues, first, let's not be Democrats and Republicans. Let's be Americans representing all of Americans. Let's recognize what you're doing just gives money to insurance companies, but we can do it better with lower premiums and with money in accounts to pay deductibles. And then why don't we come together? There can be a Democratic bill and a Republican bill, and both fail. Let's do an American bill where the American people benefit, and let's work together, collaborate to lower those premiums and to help them with that first dollar coverage in the deductible.
So we looked, and there are about 293,000 Louisianans, your state, enrolled in Obamacare currently. 6 weeks from now, those expanded tax credits that you've been talking about will go away for individuals making $62,000 or above. Individuals making less than that amount will see their tax credit shrink. So are you telling those hundreds of thousands of Louisianans that that tax credit's going away no matter what, that they should make plans for higher price?
I'm telling them that we are working to make it work better for them. And they would tell you, by the way, wait a second, I got a $6,000 deductible. That does not work for me. Margaret, I'm a doctor. I would talk to people when they'd come to see me, and they would tell me, I can't afford that. My deductible is too high. That's reality. And that reality is being lost in this discussion. We've got to do something about sky-high deductibles. Maybe you can afford the premium, you can't afford the policy. Let's lower the cost of having health insurance, focusing by not just on the premium, but the deductible, and I think we can do both.
Well, even in the private market, health care costs have gone up about 6 to 9% when you look at the projections. But I want to ask you about your oversight role. Secretary Kennedy has this hand-picked panel of vaccine advisors. You know them at ACIP. They're going to meet in a few days and potentially vote on changing the hepatitis B vaccine schedule for infants. That same vaccine advisory group is also considering the safety of vaccine ingredients like aluminum, which would impact a number of childhood shots. This should matter for American parents. Are you comfortable with what they are about to put to a vote?
I'm very concerned about this. As it turns out, my medical practice focused on hepatitis B. And so we know that because of a recommended dose at birth of hepatitis B vaccine, recommended, not mandated, the number of children born contracting hepatitis B at birth or shortly thereafter has decreased from about 20,000 20 years ago to like 200 now. That's effectively a clerical error. We have decreased the incidence of chronic hepatitis B by 20,000 people over the last 2 decades with this kind of recommendation. And by the way, if you're infected at birth, you're 95% likely to become a chronic carrier. The vaccine is safe. It has been established. And these ingredients they're speaking of have been shown to be safe. This is policy by people who don't understand the epidemiology of hepatitis B or who've grown comfortable with the fact that we've been so successful with our recommendation that now the incidence of hepatitis B is so low, they feel like we can rest on our laurels. I'm a doctor. I have seen people die from vaccine-preventable disease. I want people to be healthy. I want to make America healthy, and you don't start by stopping recommendations that have made us substantially healthier.